Assalamu alaikum. Welcome in my live and happy and your places and part taking part in the development of your country, your region, your province, your state, your city, your family and your home. Who are new on my YouTube channel, please my channel like this live and for feedback write some comments and you can ask questions on today's topic if you have any doubt about today's topic. Let's start today's topic. Today we will discuss about joints. Today's topic is about joints. About joints, there are some terms we should understand. Remember, number one, arthrone. Arthrone, it is a Greek language. Sign, arthrosis, diarthrosis, arthritis, arthro diseases, arthro disease, etc. Articulatio, Latin language, mean a joint. Articulation, junction, Latini language, a joint. Sign, dysmology, Greek language, word, sign, dysmosis, equal to ligament. Is the study of ligaments and related joints. Definition of joints. Joint is a junction between two or more bones or cartilage. It is a device to permit movements. However, immovable, immovable joints are primarily meant by growth. Primary cartilaginous joints of long bones increases length of bone. A newborn baby is about 15 inch long and length increases to 60 to 70 inch in adult due to growth at these joints. Fontanelles of skull may permit modeling during childbirth. There are more joints in a child than in an adult because as growth proceeds, some of the bones fuse together. For example, the ilium, ischium, and pubis to fuse form the pelvic bone. The two halves of the infant frontal bone and of the infant mandible also fuse to form single frontal and mandible bone respectively. The five sacral vertebrae fuse to form sacrum, and the four coccygeal vertebrae join to form coccyx bone. Joints help to form cav- cavities like cranial, thoracic, abdominal, and pelvic cavities, where the respective organs are safely kept. Joints of thoracic cage help in increasing transverse and vertical diameters of the cage, helping in respiration. Classification of joints. Number one, structural classification. Number one, fibrous joints. Three category: sutures, syndesmosis, gum fosses. Number two, cartilaginous joints. Primary cartilaginous joints are or syndesmosis. Secondary cartilaginous joints or symphysis or amphiarthrosis. Number three, synovial joints, ball and socket or sphenoidal joints, saddle or saddle joints, condylar or bicondylar joints, ellipsoid joints, hind joints, pivot or torchoid joints, plant joints. Fundament functional classification. It was about structural classification. The second is functional classification according to the degree of mobility. Synoarthrosis, immovable, like suturing of the fibrous joints. Amphiarthrosis, slightly movable, like secondary cartilaginous joint. Diaarthrosis, freely movable, like synovial joints. Synarthrosis or fist joints at which there is no movement. The articular surfaces are joined by tough fibrous tissue. Often the edges of the bones are down dovetailed into one another as in the sutures, sutures of the skull. Amphiarthrosis or joints at which slight movements is possible. The articulating bones are covered by hyaline cartilage, a pad of fibrocartilage lies between the bone surfaces and there are fibrous ligaments to hold the bones and cartilage in place. The cartilage of such joints also act as shock absorbers. For example, the intervertebral disc between the bodies of the vertebra. The arthrosis or synovial joints are known as freely movable joints. Through it with at some of them the movement is restricted by the shape of the articulating surfaces and by the ligaments which hold the bones together. These ligaments are of elastic connective tissue. A synovial joint has a fluid called filled. A synovial joint has a fluid filled cavity between articular surfaces and which are covered by articular cartilage. The fluid, known as synovial fluid, is produced by the synovial membrane. The synovial membrane lines the cavity except for the actual articular surfaces. It covers any ligaments or tendon which pass through the joint. Synovial fluid acts as a lubricant. The form of the articulating surfaces controls the type of movements which takes place at any joint. The movements possible at synovial joints are which movements are possible. It is mentioned different movements are possible at their angular, rotatory, gliding, angular movements, flexion, extension, abduction, and adduction. What is angular flexion movements? They do decreasing the angle between two bases or two parts. Extension, increasing the angle between two bones or two parts. Abduction, moving the part away from the midline. Adduction, bringing the part towards the midline. Rotatory rotation, rotating along the vertical axis. Circumduction movement the extremity or the part round in a circle so that the whole part inscribes a cone. When flexion, abduction, extension, and adduction occurs in sequence, the movement is called as the circumduction. Gliding one part slides in another. Regional classification skull type immovable, vertebral type slightly movable, limb type freely movable. According to number of articulating bones, simple joint when only two bones articulate, for example, interphalangeal joints. Number two, compound joints more than two bones articulate with one capsule, for example, elbow joint, wrist joint. Complex joint when joint cavity is divided by an intra-articular disc. For example, temporomandibular temporomandibular joint, sternoclavicular joint is this agreemented representation of complex joint. The structural classification is most commonly followed and will be considered in detail in the fibrous joint. In fibrous joints, what happen? In fibrous joints, the bones are joined by fibrous tissue. These joints are either immovable or permit a slight degree of movement. These can be grouped in the following three subtypes. Number one, suture. Sutures, sutures are present only in skull. Sutures are sutures are present only in skull. Two bones are separated by connective tissue. The sutural side of each bone is covered by a layer of osteogenic cells. Cambial layer called covered by capsular layer which is continuous with the periosteum. The area between the bones decreases with age so that osteogenic surfaces become opposite. Sutures may synostos and get obliterated as age advances. Sutures are peculiar to skull and are immovable according to the shape of bony margins. The sutures can be plain, for example, intranasal suture, serrate, for example, interparator suture, squamous, for example, temporo temporoparator suture, denticulate, for example, lambnoid suture, skin dilalis type, for example, between rostrum of sphenoid and upper borders of vomer. Neonatal suckle reveals fontaniles which are temporary in nature, permit modeling during normal childbirth. At six specific points on the sutures, a newborn skull or membrane filled gaps called frontaniles. These also allow the underlying brain to increase in size. Anterior frontanalis is used to judge the hydration of the infant. All these fontaniles became born by 18 months. Syndesmosis, it is a fibrous union between bones. It may be represented as interosseous ligament as in inferior tibiofibular joint, as a tense membrane as in posterior part of sacroiliac joint, or as interosseous talocalcanean ligament. Gomphosis, it is a part Gomphosis, it is a pig and socket junction between the tooth and the socket. The od- the, the odontal ligament connects the dental element to the alveolar bone. Actually, gomphosis is an articulation between two bones. Who are present on my live, please like the live and give some comment. and introduce yourself. Who are you? Where are you from? Like the live cartilaginous joints. In this type of joints, the bones are joined by cartilage. There are these are of the following two types: primary cartilaginous joints, secondary cartilaginous joints. Primary cartilaginous joints, also called synchondrosis or hyaline cartilage joints. The bones are united by a plate of hyaline cartilage so that the joint is immovable and strong. These joints are temporary in nature because after a certain age, the cartilaginous plate is replaced by bone synostosis. These are seen in between epiphysis and diaphysis of long bone. These are associated with growth or epiphyseal plates and increasing length of the bone. Primary cartilaginous joints or synchondrosis becomes these joints are temporary in nature because after a certain age the cartilaginous plate is replaced by bone synostosis. These are seen in between epiphysis and diaphysis of long bone. These are associated with growth or epiphyseal plates and increasing length of the bone. Primary cartilaginous joints or synchondrosis becomes synostosis after some age and are not identifiable. For example, joint between epiphysis and diaphysis of For example, joint between epiphysis and diaphysis of a growing long bone. Spheno-occipital joint. Welcome Umar Farooq Bhai. Welcome MD Whitecoat. Spheno-occipital joint. First, chondro-sternal joint. Costo-chondral joints. Secondary cartilaginous joints, also called symphysis or fibrocartilaginous joints. The articular surfaces are covered by a thin layer of hyaline cartilage and united by a disc of fibrocartilage. These joints are permanent and processed throughout life. In this respect, symphysis menti is a misnomer as it is a synostosis. Typically, the secondary cartilaginous joints occur in the median plane of the body and permit limited movements due to compressible pad of fibrocartilage such as in the pubic symphysis and manubriosteal joints. The thickness of fibrocartilage is directly related to the range of movements. Secondary cartilaginous joints may represent an intermediate stage in the evolution of synovial joints. Examples are symphysis pubis, manubriosteal joint, intervertebral joints between the intervertebral joints between the vertebral bodies. The disc varies from few millimeter to 10 millimeter and there is dense connective tissue with the chondrocyte. Collagen ligaments extend from the periosseous of articulating bones across symphysis to blend with perichondria of hyaline cartilage. Complete capsule Complete collagen ligaments extend from the periostis ostia of articulating bones across symphysis to beginning with perichondria of hyaline cartilage. Complete capsule is not formed, but places of afferent nerve terminals are seen. It can withstand stress of compression, tension, shear, etc. Range of motion is limited. Primary and secondary cartilaginous joints are concerned with strengths and to withstand forces. These transmit weight, force, growth occurs in both types. Both are concerned with movement, rigidity of synchrondosis improves the efficiency of nearby synovial joint. Movement of a vertebra is the summation effect of synchrondosis, primary cartilaginous joint, symphysis, and synovial joints associated with the vertebra. Synchron- Synchondriosis allows growth of hyaline cartilaginous plates where endochondral ossification stands. Synovial joints. What are synovial joints and what characteristics? Synovial joints are most evolved and therefore most mobile type and mobile type of joints. Classification of synovial joints and their movements. Type of joint movements. Plane or gliding type. The movement is gliding movements. Number two, uniaxial joints. These are two types, hinge joint and pivot joint. Movements is flexion and extension, and the pivot joint rotation only. Biaxial joints, condylar joint, flexion, extension, and limited rotation. While an ellipsoid joint, flexion, extension, abduction, adduction, and circumduction, all movements happen. Multi-axial joints, saddle joint, flexion and extension, abduction, adduction, and conjoint rotation. Ball and socket joint, it is also called sphenoidal joint, flexion and extension, abduction and adduction, circumduction, medial and lateral rotation happen. Characters. The articular surfaces are covered with hyaline articular cartilage, fibrocartilage in certain membrane bones like clavicle and mandible. Articular cartilage is avascular, non-nervous, and elastic, lubricated with synovial fluid. The cartilage provides slip, slippery surfaces for free movements like ice on ice. The surface of the cartilage shows fine undulations filled with synovial fluid. Between the articular surfaces, there is a joint cavity filled with synovial fluid. The cavity may be partially or completely subdivided by an articular disc or meniscus. The joint is surrounded by an articular capsule which is made up of a fibrous capsule. Welcome different video. The joint is surrounded by an articular capsule which is made up of a fibrous capsule lined by synovial membrane. Because of its rich nerve supply, the fibrous capsule is sensitive to stretches imposed by movements. This sets up appropriate reflexes to protect the joint from any strain. This is called the watchdog action of the capsule. The fibrous capsule is often reinforced by number one capsular or true ligaments representing thickening of the fibrous capsule. Number two, the accessory ligaments distant from fibrous capsule which may be intra or extracapsular. The synovial membrane lines whole of the inferior. The synovial membrane lines whole of the interior of the joint, except for the articular surface, covered by articular cartilage. The membrane secretes a slimy viscous fluid called the synovia or synovial fluid. The membrane secretes a slimy viscous fluid called the synovia or synovial fluid, which lubricate the joint and nourishes the articular cartilage. The viscosity of fluid is due to hyaluronic acid secreted by cells of the synovial membrane. Varying degrees of movements are always permitted by the synovial joints. Classification of synovial joints. Number 1. Plain synovial joints. Articular surfaces are more or less flat plane. They permit gliding movements, translections in various directions. Examples: intercarpal joints, intertarsal joints, joints between articular processes of vertebra, cricothyroid joint, cricotinoid joint, superior tibiofibular, interchondral joint, costovertebral, costotransverse, acromioclavicular with intra-articular disc, carpometacarpal except first, tarso-metatarsal, intermetacarpal, intermetatarsal, chondrosternal except first, sacroiliac, Heinz joint. It is also called gingivalemi, gingivalemi. Articular surfaces are pulley shaped. There are strong collateral ligaments. Movements are permitted in one plane and around a transverse. For example, elbow joint, ankle joint, interphalangeal joints. Pivot or crochoid joints. Articular surfaces comprise a central bony pivot ridge surrounding by an posterior ligamentous ring. Movements are permitted in one plane around a vertical axis. Examples: superior and inferior radioulnar joints, median atlantoaxial joint, number 4, condylar, who who are present on my live, please like the live and put some comment. Please like the live who are new on my live. Number 4, condylar bicondylar joints. Articular surfaces include two distinct condylars, convex male surfaces fitting into reciprocal concave female surfaces, which are also sometimes known as condyles, such as in tibia. These joints permit movements manually in one plane around a transverse axis, but partially in another plane rotation around a vertical axis. For example, knee joint, right and left jaw joints, or temporomandibular joint. Ellipsoid joints. Articular surfaces includes an oval convex male surface fitting into an elliptical concave female surface. Free movements are permitted around both the axes. Flexion and extension around the transverse axis, and abduction and adduction around the anterior-posterior axis. Combination of movements produce circumduction. Typical rotation around a third vertical axis does not occur. For example, atlanto-occipital joints, wrist joint, metacarpopharyngeal joints. Number 6, saddle ciliar joints. Articular surfaces are reciprocally concavo convex. Movements are similar to those permitted by an ellipsoidal joint, with addition of some rotation. Conjunct rotation around a third axis, which, however, cannot occur independently. Examples: first, carpo metacarpal joint. Sternoclavicular joint, calcaneus, calcino ocul, calcinocuboid joint, incudomedular joint between femur and patella. Ball and socket are also called spheroid joints. Spheroid joint. Articular surfaces includes a globular head male surfaces fitting into a cup-shaped socket female surface. Movements occur around an indefinite number of axes which have one common center: flexion, extension, abduction, adduction, medial rotation, lateral rotation, and circumduction all occur quite freely. Examples: shoulder joint, hip joint, talocalcaneus, talo, talocalcaneo, navicular joint, and pseudostapedial joint. Classification and movements of synovial joint. Number one, terminology and definition. Human kinesiology, study of geometry of surfaces and their associated movements. Male surface, in articulating surface which is larger in surface area and always convex in all directions. It's called male surface. Female surface, in articulating surface which is smaller and concave in all direction is called female surface. Interesting terms these are. Simple joints, joints with only two articulating surfaces, male and female, is called simple joints. Compound joints, joint possessing more than one pair of articulating surfaces, for example, wrist joint. Degree of freedom, number of axes at which the bone in a joint can move. Uniaxial movements of bone at a joint is limited to one axis with one degree of freedom, for example, interphalangeal joint. Biaxial with two degrees of freedom, for example, wrist joint. Multi-axial, there are these are along with intermediate positions also, for example, shoulder joint. Translation, sliding movements of one articulating surface over the other, for example, intercarpal joint. Movements are movements and mechanism of joints. Angular movements, movement leading to diminution or increase in angle between two adjoining bones. These are of two types. Number one, flexion and extension, bending and straightening respectively. Abduction and adduction, movements away and towards the median plane respectively. Circumduction, when a long bone circum, circumscribes a conical space. Rotation, bone moves around a longitudinal axis. Adjunct adjunct rotation, independent rotation, for example, locking of knee joint, medial rotation of femur during last few degrees of extension of knee joint, extension at this joint is accompanied by medial rotation, while flexion at the joint is accompanied by lateral rotation. Conjunct rotation, rotations which accompany other movements, for example, movements of first carpo metacarpal joint. Flexion is accompanied by medial rotation, while extension is accompanied by lateral rotation. All people who are present at my live, I hope all you are very well and happy in your places and taking part in the development of your country, your region, your province, your state, your city, your family, and your home. Who are new on my YouTube channel, please subscribe my channel. Subscribe my channel, like, live, and for feedback, write some comments. You can ask question on to the topic if you have any doubt about the topic. Today topic was joints. If you have any question, you can write in comments. Welcome all you and my live, my dear daughters, my dear friends, my dear students, my dear colleague, my dear scientists, my dear researchers, my dear physicians, my dear scholars, my dear medical staff, my dear paramedical staff, and my dear hospital medical staff, and who know me and who not know me, and who are newcomers from different countries from all over the world. All you are most welcome on my YouTube channel live. How are you? Where are you from? Please give your some introduction. Introduce yourself. Who are you? Where are you from? What you do? In which maker college you study? What kind of work you do for the welfare of humanity? You are from which place, which country, which city, and what you like. Thank you. You came in my life. Thank you. Sweet dreams.